Welcome to our NUR2106 presentation on the renal condition chronic kidney disease. This was created by Erin White, Talia Puglia, Nicole Frawley and Laura Mobilia.
Hi, my name's Erin and I'll be introducing you to our patient, Debra Brown. Debra Brown is a 65-year-old woman with chronic kidney disease. Debra has phoned a home nurse to come and visit her as she is experiencing difficulty walking due to swelling around her lower legs and ankles. The nurse assesses the swelling and documents pitting oedema in both limbs with a score of 3. The nurse asks Debra if she's noticed any other symptoms or changes in her health. Debra tells the nurse that when she goes to the toilet, her urine has a foamy appearance. This has worsened her nocturia as she is getting up more often during the night to urinate. This has had a negative effect on her performance during the day as she is feeling severely fatigued and lacks energy. The nurse performs a set of vital observations and determines an increase in Debra's blood pressure since last visit. The nurse recommends that Debra visits the hospital to have her presenting symptoms assessed in relation to her current condition and medications. Debra has a history of type 2 diabetes mellitus, hypertension and is a pack-a-day smoker. Our patient's age and sex and her symptoms of peripheral edema and foamy urine indicate Debra's chronic kidney disease may be deteriorating further. Debra's additional health conditions, including her type 2 diabetes, hypertension and smoking history, are the risk factors as to why she may have developed chronic kidney disease. These conditions need to be addressed and managed in order to determine her deterioration and prevent her condition from further worsening.
Hi, my name's Laura and I'm going to explain the pathophysiology of chronic kidney disease, or CKD, and hopefully allude to why Debra has presented with these particular manifestations. CKD is basically the irreversible loss of nephron. It is staged by the glomerular filtration rate, or the rate in which blood is filtered through the kidneys to become urine. As the disease progresses, GFR decreases, which leads to a decrease in urine production. It is important for nurses to understand the disease process in order to recognise potential complication and patient decline. There are many etiologies of CKD, including diabetes, mellitus, and hypertension. There are other common causes of CKD, but we will focus on the ones which are relevant to Debra. The first one is hypertension. This is a close-up of a functional nephron, with the glomerulus in red. Usually, when high blood pressure is experienced due to an increase in blood volume, more blood is processed through the kidneys and more urine is formed, thus reducing blood volume and returning blood pressure to normal. Debra's hypertension is the result of a pathological cause, however, meaning that this compensatory mechanism does not work. Continuous pressure on the walls of the blood vessels which lead to the glomerulus causes scarring, and the lining of the blood vessels thickens, reducing the size of the lumen. Because of this, blood flow to the glomerulus, and therefore glomerular filtration rate, is reduced. This is detected by a structure of cells in the afferent arteriole called the juxtaglomerular apparatus, which releases renin, activating the renin-angiotensin-aldosterone system, or RAS. The RAS system elevates heart rate and blood pressure with the intention of increasing blood flow to the glomerulus and increasing the glomerular filtration rate. However, as blood pressure increases, the blood vessels become even narrower and the cycle continues. This is why controlling Debra's hypertension is a vital part of preventing further deterioration of her kidney function. As with anywhere in the body, lack of blood flow will eventually cause ischemic damage, and as this cycle continues, it will lead to glomerular sclerosis, the thickening and hardening of the glomerulus itself. Another cause of glomerular sclerosis is diabetes mellitus. During hyperglycemia, more glucose is absorbed by the lining of the blood vessels in the glomerulus. This causes the basement membrane to become abnormally thick. Usually, this membrane is negatively charged, which prevents negatively charged proteins from passing through. However, glomerular sclerosis disturbs this, causing plasma proteins passage through the glomerulus. This is manifested by proteinuria, or protein in the urine, and is characterized by the frothiness Debra complained of. As a whole, this is called nephrotic syndrome. As this process continues, hypoalbuminemia, or low blood protein levels, develops, which due to a reduction in oncotic pressure causes fluid to shift from the intravascular compartment into the interstitial compartment, which is why Debra presented with edema. As antibodies are also lost in the urine, hypoalbuminemia causes a reduction in immune function, increasing susceptibility to infection. As the fluid shifts from the intravascular compartment to the interstitial compartment, it reduces plasma volume and therefore glomerular filtration rate. This is another way that the RAS system is activated, causing the body to retain more fluid, increasing blood pressure and edema. As the nephrons of the kidneys are damaged and lose their function, blood flow is diverted to functioning nephrons. This is called hyperfiltration. This temporarily works to increase the glomerular filtration rate in the functioning nephrons. However, as more pressure is put on those remaining, the damage only continues to spread. As more nephrons lose their function, glomerular filtration rate lowers further and urine output is reduced. Due to this, the body is unable to excrete waste products such as urea in the urine, resulting in uremia, which is the clinical manifestation of late-stage chronic kidney failure. This may result in neurological, gastrointestinal, skin and reproductive changes. Metabolism is also affected by CKD, which may have an impact on Debra's glucose homeostasis. Nephron damage reduces the production of aldosterone, which affects the sodium-potassium ATPase pump at the distal end of the nephron. If this pump does not work, potassium is retained, the most serious consequences of which are cardiovascular in nature. Due to CKD's direct and indirect effect on the heart, Debra is more likely to face mortality from heart disease than renal failure itself. The consequences of deteriorating CKD are widespread and serious. These are just some examples. As you can see, the escalation of this disease is exponential, which is why intervention is vital to prevent Debra's rapid deterioration. Without adequate treatment, Debra's GFR will fall below 15, putting her into end-stage renal failure, meaning she will need a transplant or dialysis to survive.
Standard 4 Medication Safety. Standard 4 aims to reduce the occurrence of medication incidents. This standard will require us to identify if Debra has any known allergies, identify drugs that contraindicate with chronic kidney disease and avoid using these when treating Debra's condition, and use the 7 rights of administration to prevent drug errors when administering medication to Debra.
Hi, my name is Talia and I'm going to be focusing on the pharmacological interventions for Debra Brown. There is a variety of different medications that could be prescribed to Debra as she is presenting with various symptoms thus leading to chronic kidney disease, otherwise known as CKD. As there is no direct pharmacological intervention to treat CKD, it is crucial to treat Debra's comorbidities instead. Treating her comorbidities and reducing her risk factors will simultaneously assist in the management and control of Debra's CKD. The most relevant comorbidities that Debra is presenting with that would affect her CKD are hypertension, edema, type 2 diabetes mellitus, and the high risk Debra is now at of cardiovascular disease.
With this, the first medication I'll be discussing is metformin. Metformin is an anti-diabetic drug which is given to type 2 diabetics to lower their blood glucose levels. In order to better manage Debra's CKD, her type 2 diabetes needs to be controlled. Metformin is contraindicated in individuals that are hypersensitive to metformin and individuals that have renal disease or metabolic acidosis. Some expected side effects of metformin are diarrhea, nausea, vomiting, abdominal bloating, flatulence, anorexia, unpleasant or metallic taste, megaloblastic anemia, and lactic acidosis. In Debra's case, it is important for her nurse to monitor her oxygen saturations in case she does become hypoxic, and if this happens, metformin should be discontinued. Debra's comorbidity of hypertension needs to be treated in order to better manage her CKD. A medication we believe Debra should be prescribed to treat her hypertension is cilazapril. Cilazapril is an angiotensin-converting enzyme inhibitor, also known as an ACE inhibitor. The action of cilazapril in simple terms is to reduce sodium and water retention and essentially blood pressure. Cilazapril is contraindicated in individuals who are hypersensitive to ACE inhibitors and have previously been treated with an ACE inhibitor and developed angioedema as a result. As you can see, cilazapril has various side effects. It is important to look out for signs of hyperkalemia such as nausea, vomiting, chest pain and fatigue, to name a few. Once cilazapril is administered to Debra, the nurse will need to regularly monitor her blood pressure, as well as regular monitoring of bloods, particularly increases in potassium, creatinine, urea, bilirubin, and decreases in hemoglobin and hematocrit levels. Oedema is Debra's next comorbidity that needs to be treated in order to control and manage her CKD. Oedema can be treated with a diuretic such as furosemide. Furosemide inhibits sodium and chloride reabsorption at the proximal and distal tubules and the ascending loop of Henle. Some side effects of furosemide to specifically look out for is symptoms of furosemide toxicity. Symptoms of furosemide toxicity include severe abdominal pain, a sore throat, ringing of the ears, and a fever. Relevant associated safety considerations for furosemide is frequent monitoring of weight, blood pressure, pulse rate, blood glucose levels, fluid intake and output, and serum electrolyte, urea, and carbon dioxide levels. The fourth comorbidity that needs to be treated in order to improve Debra's CKD is the high risk she is now at for cardiovascular disease. This can be treated by an antiplatelet agent such as aspirin. Aspirin is contraindicated in individuals who are hypersensitive to the drug, who have G6PD deficiency bleeding disorder, and in people with non-steroidal anti-inflammatory drug-induced sensitivity reactions. Some side effects of aspirin include tinnitus, hearing loss, hepatitis, rash, bruising, urticaria, nausea, gastrointestinal distress and bleeding, occult bleeding, dyspepsia, thrombocytopenia, leukopenia, and prolonged bleeding time. In Debra's case, she should be advised to take aspirin with food, milk, or a large glass of water to avoid gastrointestinal reactions. And if Debra is prescribed a high dose, she needs to be advised to watch for signs of gastrointestinal bleeding, bleeding gums, and pepetia.
Standard 9. Recognising and responding to clinical deterioration in acute healthcare. Standard 9 ensures a patient's deterioration is recognised promptly and that appropriate action is taken to resolve the problem. This standard is important in regards to Debra's condition, as chronic kidney disease can potentially lead to kidney failure if not treated appropriately. Kidney failure can result in the need of dialysis to replace the function of the kidneys, or a kidney transplant, in which we aim to prevent from occurring. Standard 3. Preventing and controlling healthcare-associated infections. This includes safe handling and disposal of sharps when testing Debra's blood glucose levels and performing blood tests for diagnostic purposes.
Hi, my name is Nicole and I'll be discussing the nursing management recommendations for Debra's care. As chronic kidney disease, also known as CKD, cannot be treated directly, as mentioned earlier, it is important to manage her comorbidities, which have a direct influence on her renal function and can prevent further kidney damage. The priority for Debra is to manage her hypertension and diabetes and to closely monitor her for signs of renal failure. An important technique to manage her hypertension and diabetes, other than pharmacologically, is to educate her on the importance of a healthy diet and lifestyle, which can help prevent the requirement of dialysis in the future. The priority of the nursing management in Debra's care involves monitoring her comorbidities. The two major factors linked to Debra's chronic kidney disease is her diabetes and her hypertension. Part of monitoring her diabetes includes doing regular blood glucose level tests and managing a healthy diet, which includes regular interval eating. Part of managing her hypertension involves monitoring her blood pressure regularly. It is recommended that her blood pressure is assessed every 4 hours. This is especially important due to the medication she is on, as we want to ensure that her blood pressure does not drop too low and that the medication is also effective. Another way of managing her hypertension is to encourage her and educate her about the importance of regular exercise and a healthy diet. Part of the nursing management for Debra's care involves managing her diet and lifestyle factors. This includes encouraging her to quit smoking and providing her with the tools and resources to do so. This also involves educating her on the importance that quitting smoking has in her care. It is recommended that Debra engages in a minimum of 30 minutes exercise daily. This is to improve her cardiovascular health and overall health, therefore having a large impact on the rest of her treatment. As Debra is a female, it is recommended that she limits her alcohol intake to no more than 1 drink per day. Debra should also aim to maintain a healthy BMI of between 18.5 and 24.9 kilos per metre squared. In order to prevent further cardiovascular disease, which is often linked to chronic kidney disease, it is important that Debra reduces her salt intake and aims to keep it less than 2 grams per day. And then it is also recommended that Debra maintains a low protein diet. She should aim to have around 0.6 of a gram per kilogram per day. Therefore, Debra should also be referred on to a dietitian to help manage her diet, which will therefore help to manage her chronic kidney disease and the symptoms and comorbidities that surround it. It is important to do regular blood tests to monitor Debra's condition. She should be tested for a full blood count, known as an FBC, her urea and electrolyte levels, known as U&E levels, and her serum creatinine levels. Her U&E levels are especially important to determine whether the medication she is on is having an impact on the urea and electrolyte levels within her body. This also allows us to correct any issues there may be with this. Part of the nursing management involved in Debra's care includes monitoring her glomerular filtration rate, also known as her GFR. This is used to indicate her renal function. Her GFR is calculated using a formula which involves her serum creatinine level, her age, her race, and her gender. This then generates a score which indicates the stage that Debra is in a chronic kidney disease. This also indicates the progression of Debra's chronic kidney disease and will also show when she is requiring or if she requires dialysis. The pitting edema that Debra has presented with indicates fluid retention. Fluid retention can have a great effect on the overall body and functioning. It is important to regularly monitor and score the pitting edema in her lower limbs. This will then indicate if her fluid retention is worsening or if the medication is effective. It is recommended that Debra is placed on a fluid balance chart and is put on a fluid restriction of 1.5 litres per day. It is very important that we resolve Debra's fluid retention to then prevent further complications, such as a decrease in circulation, which can then cause effects to wound healing and when put alongside her diabetes may lead to infection or even neuropathy. Fluid retention also impacts on the cardiovascular system. As it increases the workload on the cardiovascular system, this may lead to cardiovascular disease. It is important throughout Debra's care to monitor her renal function. This will show when she needs or if she needs dialysis. Other than her GFR, it is also important to look out for other indications for the need of dialysis. This includes volume overload that is unresponsive to diuretics, hypertension which is unresponsive to treatment, and the presentation of symptoms such as fatigue, nausea, vomiting, loss of appetite, signs of malnutrition, and insomnia.